Hi, I'm Dr. Larry Nichter. I'm co-founder of Pacific Center for Plastic Surgery and BioSpa, our medical spa. I wanted to talk to you a little bit about ALCL. That's an acronym for anaplastic large cell lymphoma, a pretty scary term. So first of all, let's figure out the incidence of this. There's been less than 600 cases of this worldwide, in millions. Well, in the United States, there's about 300,000 cosmetic augmentations using silicone breast implants, and another 100,000 for reconstruction per year. And that's been about the same statistics over the last 10 years. That's probably over 4 million in just 10 years. Worldwide, we're talking about many times that, if you think of all the countries in Europe and South America. And so we're talking about 10, 20 million people or more out there, and out of that, just a small little fraction have developed this problem. Secondly it's only with textured implants. In the United States, 90% of the implants plus are smooth implants. There's never been a case of this problem with someone with a smooth implant, except for a few exceptions, 4 or 5 or 6. And they've always had a history of a prior textured implant. So it's the texturing that's related to it. Secondly most of these cases that have been reported, the vast majority are a single company. And that's Allergan that has a more aggressive texturing. And the good news is they've taken very responsible actions and have taken this implant off the market in both Europe and the United States. So it's no longer available if you're thinking about getting another one. The other implant companies that offer textured devices, although its likelihood, the incidence would be 1 in many tens of thousands of cases of the likelihood that could affect you. So in other words, if you were to just drive 10 miles away to come to my office, the risk of driving to my office would probably be about the same or more than the risk of developing this problem. So hopefully that'll allay a lot of your fears. Now, if you do have a texture implant, it usually on average takes about 14 to 17 years to develop this. The earliest case was at 4 years, so it takes quite a bit of time. And there's usually, the vast majority of cases, the symptoms are that your breast grows dramatically larger very quickly. It's due to fluid buildup. You could theoretically feel the lump underneath your arm or in your breast and so on. And if so, you could certainly, look for that. So if those symptoms occur, absolutely see your plastic surgeon. And lastly if your implants are more than 10 or 12 years old, I definitely recommend seeing a plastic surgeon.